Some of the main challenges to making that change to a team-based approach are reimbursement. Number one, many of the states, many organizations do not pay for anything other than a provider actually providing the care. And so if, in fact, with team-based care, you might go to nurse visits, pharmacist visits, group visits, and to get reimbursement for that is really very difficult. Now, if we only knew, if everyone only knew, that by having team-based care, they would be able to clear up some of the backlog or the constraints that happen within their system, and they would be able to see more patients overall, that maybe the reimbursement is not as dramatic a difference than what they thought it was. Another issue would be leadership. Many times we use the quote, attention is the currency of leadership. And people really pay attention to what leaders are paying attention to. And if they themselves are exhibiting a team-based culture themselves, that will lead to more team-based approach within the organization itself. The other thing are trust issues. Providers are typically very high performers, and they have not been taught within their educational program to collaborate with others or to necessarily listen to others as far as making their decisions. And so the biggest struggles we seem to see around the country are where the provider has perhaps a lack of trust that somebody will be able to do that same job as well as they are. And so it's a matter of then training, the opportunity to be able to test small scale and be able to see that they actually can trust the person, seeing the kinds of outcomes that could result from team-based care, I think would help build will and a trust within the physician organization.